Hey.
Hello. Okay. Well, it is officially beginning here. This is another healer highlight. We're going over chapter 2 today of The Gift of Healing Hands with my dear friend and colleague, Dr. Mellissa Caufield. How are you doing?
Hello. Hey, Marina. How are
Yeah.
you?
I'm really happy to have you all the way from Chicago today. This chapter, I've been trying to pick a person who I think kind of matches some of the cool conversations I've had with each chapter. This one's all about that subconscious healing and the things going on underneath what we're looking for as chiropractors. So just to start, please introduce yourself, let us know a little bit about where you are, your practice, and we're going to dive in.
Awesome. I'm Melissa. I'm from Chicago, the Chicagoland area. I own a practice in Geneva and Lisle. My husband and Dr. Yang manage the Geneva location. I'm in the Lisle location with Dr. Julia. She's wonderful. We have a very low-key practice, very one-on-one, but
Mhm.
also very fun because we do have a lot of athletes and it's so cool to see that. But we also have athletes that have other needs that are a little bit deeper, even if it's just an active mom or just an active dad that just wants to get back into the gym, CrossFit,
Mhm.
whatever he wants to do. It's pretty cool because we do get a lot of time with our patients and you get to really know them. So that's kind of the cool jazz about my practice.
Mhm.
I'm not one to rush someone out. They could stay as long as they like. It's usually a party, so we love it. I wouldn't change it for the world. It's a little different than the typical chiro office, but I like it. So we've been sticking with it.
Which is what we're going to talk about today. Yeah, I mean, even just in our foundation, both you and I have kind of been raised through very manual, very athletic, strong manual adjusting. I mean, I've
Mhm.
been adjusted by a lot of people,
Yeah.
and to this day, you are still my favorite adjuster.
Oh, thank
You
you.
rock my socks when you adjust me. But the magic of that ability is, knowing when it's appropriate, knowing
Yes,
when
absolutely.
there's so much other things going on to even get to that level of the trust that I have when I sit down with you and allow you to do those things.
Well, I love that.
So go ahead.
I love that. I love that it's trust because it's everything. It really is.
Yeah, yeah, and I think it's interesting because most of these other conversations I'm having are with the men. We are kind of limited in our field. There are a lot of female chiropractors if you're not familiar with that, but not so many sports female chiropractors, which is
That's true.
kind of what I guess we have to used to describe ourselves as. I think
Yeah.
I try to start off like that, oh, I'm a sports chiropractor, but but we're
Exactly.
going to work on a lot of different things that maybe you didn't have an opportunity with your chiropractor, beyond muscles, beyond bones, beyond movement. Really, we're going to get into
Absolutely.
some of the mentality, pain mentality. Athletes especially have such a history of competition, injuries, let down, all of that's just swirling around in their head every time they put their body into motion again in their sport. So I always wonder, do you introduce yourself as a sports chiropractor, or how do you get into this?
I think everybody knows me as a sports chiropractor when they first come in. They're
Mhm.
like, "Go see Mel. She's got it. She was small, but just go give it a try." So I think that's pretty cool to get that. But then I'm like, we also have a little bit more to offer, and I think people get that when they first visit. So I really love that because it just opens their eyes to a lot of things. I'll get someone who comes in and they're super closed off. They're like, "Oh, I just came here for an adjustment and this." And I'm like, sorry, friend, we're going to do more because I think it's going to help you."
Right.
And then they leave and they're like, yes, okay, I think I needed that. I think they just come in with this mindset that, oh, I'm just going to a chiropractor, so I'm just going to get
Mhm.
adjusted today. And I'm
Yep.
like, there's a difference. It's cool.
Yeah.
Um, and I think that's the fun part is introducing them to something new.
Mhm.
And that's the best thing. Cause then they're like, oh, I never thought I needed, or I didn't know I was tight. And I'm like, half my job is just honestly helping you become aware,
Right.
just aware. I
If
don't
I've
even,
done nothing, I hope I teach you how to talk to yourself
yeah,
and recognize
absolutely.
things. Yes.
Right, absolutely. And I noticed that with a lot of patients that come in, they're like, with the sports mentality, they're like, I have to get on the field. What do I
Right.
do? My husband is phenomenal at it, so I'll give him that. But he's like really good at getting an injured person to the field and confident on the field. I tell him he's the master of the yips. I am not the master of the yips, kind of, but I'm also that one that likes to prep him for the next step, or prep whoever it may be for the next step. So I always tell people I work more in here and the more of the passive care. My husband works more in the active care. So I love that I have that inner dimension in my practice where I can say, you know what, I'm not good at that, but this guy. So that's where I'm at with my practice. In the beginning, I was like, I'm going to do it all.
I can do everything. I'm amazing. Yeah.
And honestly, it was a big ego letdown. I'm like, in a way, it's a good ego letdown. So I always tell people it's good to like recognize there's no freaking way. Yeah. There's no way.
There's no one right system for everybody. There's no one right doctor for everybody.
Right.
And I think that's a theme of like a lot of kind of what I would consider, I hate to ever say like, oh, well, that's a modern chiropractor and then anything else is not, but I think in a modern kind of dynamic facility, most of our kind of realm of chiropractors are working with other people. Like we understand the team unit. There's just this like other like community aspect that we would never have access to by ourselves. And it fills in those holes. So in my end, I don't have another chiropractor here with me, but I do have these really talented women on Pilates equipment, like nothing I've ever been exposed to as an athlete, in college and things like that. And these women are so talented at finding these like minutia micro movements in muscles that, I think we're wiring and we're preparing the body for, but then it's like the PT, the Pilates, they're reinforcing that and rehabbing that to get back to activity. So, it's such a perk of creating like the autonomy in chiropractic is we can design and build cool friends around us to make a practice.
Absolutely. That's why I tell people like it's collaborative. What
were you gonna say?
It's collaborative. Everything's collaborative.
It is. And I know you have another doc in your practice who was kind of a mentor to you. Would you say that like he was somebody who really introduced you to a lot of you said we're going to do more than chiropractic. Where did you first get introduced to the more? Like, let's talk about what that is.
The more. Okay. So I think one time, this is kind of cool. So when I was in chiropractic school, I met a woman who I was having a hard time. I was preparing for a marathon. I just came back from chemotherapy. I had an abdominal surgery. It was pretty invasive. So tons of scar tissue. And I was telling everybody, I'm like, I know I'm having IT band, but it's not my IT band. Like something's up. And I was a little scared to even touch my scar and work through that. So this is where that kind of that scar mentality comes in, because I feel like athletes do a good job like suppressing it. They're like, I can do it. I can do it. I can do anything.
Yeah.
So, which is great. But then I was like having this like a realization, like I got to do something and something's not right. And it's truly impinging my ability to actually do things or that I want to do. And I love to be athletic. And it was just a big slam in the face. So I met this woman in school and she was a clinician, which is great. And she's like, we're going to work your scar. I'm like, I have to show someone my abdomen. Like what? So there was a lot of shame on my end. And what she did is she worked it and holy cow, was I just bruised. She wasn't even touching heavy. It was light. It was gentle. It was
manual, just like soft tissue.
Yeah. It was almost like borderline so soft that you would never think it was therapeutic. Holy moly, was I black and blue. And I think that like woke me up a lot. It was like, oh, okay, I actually do need to be on top of this. And I noticed that my bowel movements were better. My anxiety was better. Before I felt like I would get anxious and I had no clue why. But she kept doing this, and that was the thing. It wasn't even my IT band. Everybody was working the IT band.
Yeah.
And when she brought it up a little closer to home, and when I say home, I mean the abdomen, your gut, your trunk.
Yeah.
I consider this home. When that is better and sound, I feel like everything else kind of releases, relaxes, and gets a break.
It's the foundation that allows them to do their auxiliary movement.
Exactly. So that was just an eye opener on a personal level. And I'm like, okay, I got kind of obsessed. So a lot of research went into it, a lot of just looking at fascia and just dissecting it further and looking at it from even on a dissection standpoint. I was like, holy cow, like I'm missing something. So when I went into practice, I met Dr. Yang. He is my mentor to this day. I love that man. He is awesome, but he was very much like, listen, girlfriend, we're going to work tissue and it's not going to be fun sometimes, but I think you'll like it. And he gave me a very solid foundation. He showed me how to do like pretty much anything on the table just to
Mhm.
keep everybody in a good spot.
Okay.
And I think after that, I started fusing my stuff, but I wanted to master his foundation first.
Right.
And once
Right.
I got that, I was like, all right, we're going to add this and this based on the patient though.
Mhm.
So, like it was in the beginning, I always tell people you would know I was struggling because you would hear my feet shuffle in the room. You would literally hear my feet like, because I was thinking, but I wasn't like, where do I go? What do I do?
Right.
And now I'm like, it's go so fast that I'm constantly like, okay, check in, let's go.
Mhm.
Check in, let's
Yeah.
go.
We
So
also, I think, as more experienced clinicians too, we understand that there is this just like, intuition or pattern recognition that, we've done it so many times now, or we've seen what's helped somebody else, that we just automatically go to this next step, even if it's like seemingly unrelated, like really wild assumptions. So a little less shuffling, a little bit more, even if it's not 100% the right next move, I know I'm going to get to it, and I know I'm going to find out more when I get my hands on this new spot.
exactly,
Yeah.
exactly. And I feel like I probably made my patient anxious based on my shuffling. That now that I look back and I'm like, oh man, I made this person anxious. That was the
Like,
last part.
I hope they don't give up on chiropractors.
No, no. And usually I explain, I'll be like, listen, I'm not gonna lie, I was stumped. And they appreciate that.
Oh yeah.
So I think that helps bring down the boundary too, is that you're like, oh, okay, she's human too. So we're
Mhm.
gonna work together. And that's the thing. I try my best to always say we. We're never
Me too.
doing I
I love that.
or you, maybe you, but if I have to call you out, but
Mhm.
it's always we, from the moment that they walk in the door to the moment they leave. It is
Yep.
we. And I
Absolutely.
tell them you can scream, you can do whatever you want as long as we do it together.
Yeah. Which is so interesting because, like, from a different background, not to change the subject too much, but in yoga training, like, they teach a lot of empathetic listening and like really sensitivity training in our conversation, our connection, which I really attribute yoga teacher training to my bedside manner in chiropractic.
Amazing.
Like,
Amazing.
chiropractic school did not teach you how to speak to humans, how to make them comfortable. So I really love yoga for that. But I remember my teacher specifically saying, don't use we. It almost seems like passive
Yeah.
aggressive. And I'm like, nah, I don't agree with
I don't
that.
know if I agree with that.
I think
Um,
it's so collective.
it
Yes.
is. It is.
Mhm.
I always tell people like my door is always open, and if you have to say anything as harsh as it may be,
Mhm.
let's go for it.
Yeah.
You're not gonna cry. I mean, if anything, we're gonna get it closer to the problem. So, in that, I noticed that when people hear that, they're like, "Oh, okay, I'm not being judged. I'm being
Right.
accepted. I'll let my boundary down, or I'll kind of take down my borders a little bit here," and
Mhm.
they come back. And sometimes it's you do have to be assertive with some people. And I noticed I in the beginning I'd be like, oh my God, did I hurt their feelings? Are they ever gonna come back? And to my surprise, everybody came back in a better light. And I was like, maybe I need to do this more often. So
Mhm.
I think that helps with my as a practitioner, like a little bit more confidence there. Um
Yep.
and
It's just it fills in the information, not that, the foundation of our skill set is chiropractic for a reason. And I think it makes us view the body in this like really interconnected, dynamic, nervous, electric system, which thank goodness we have that. But, I think when I sit and I'm talking to people and I'm touching, and I'm like, we are one of the few fields that touches people anymore. And it's
yes.
and it's not just like, oh, that muscle hurts. Oh, good, that muscle hurts. It's like, hey, fill me in. What did you do to this knee in the past? Even if it was a long time ago, I don't care. Tell me about this. Or
Right.
the conversation of scars. Like you said, especially with women,
Mhm.
there is shame. There is always a story to a scar. So, I have what I kind of say to people to explain that your body is this collection of memories and emotions. But tell me a little bit of how you would like kind of wean somebody into there's something more to your scar than just scar tissue.
Okay. Yeah. So I do kind of I'll work people over very superficially in the beginning.
Mhm.
I'm checking my zones. I'm just making sure things are working the way they need to on a very superficial level.
Yeah.
And then I start to work and I start to notice if they start to clench or move or wiggle out of my way, or sometimes I notice their breathing changes completely.
Hold
Um,
it, hold it shallow. Yep.
they'll hold it or they'll close their eyes real aggressive or they'll even start to tear up.
Mhm.
So when that moment happens, I'm like, do you mind if I always ask for permission. I'm
Yeah.
like, may I work here a little bit if you mind? And they're like, okay. And then I'll notice they'll kind of come around, um and they'll just kind of they'll settle. and I think they get a little quiet, and that's what I'm really curious about. I'm like, oh, what are you thinking? But
Mhm.
eventually when the moment is right, I'll say, can you tell me about this? Like, how did you get this? Is there
Mhm.
anything like you think that, what does this do for you? Or how does it affect you? And usually sometimes I'll get the waterworks,
Mhm.
or I'll get people just like real hot and angry. And I'm like, why are you angry? And then they'll tell me. So
Yes.
I think that's kind of cool to see that come out when you start
Mhm.
working. But I'm super gentle in the beginning because you just don't know what that may have triggered. Maybe, unfortunately, it
Yeah.
does go deep to maybe there was a lot of shame growing up with a parent, or they were abused,
Mhm.
or there was a surgery and it wasn't a good surgery. Like something was different.
Yeah.
Um,
Motivators to surgeries
yes,
really
yeah,
come out. So I see it most. I mean, I worked in Oklahoma, which is like the land
yeah,
of the breast implant. And even I
okay.
so
Even this, even
have
that,
I have got really, really well, good experience in
yeah,
understanding the damage and the effect caused by what some people consider, oh, that's cosmetic, that's an elective surgery.
right,
We have no idea what they have gone through, what motivated them to get there, or
right.
often who motivated them to get this procedure.
Uh-huh.
So it's not just, oh, I'm just going to scrape this out, we're just going to rub this out. It's, there's self-forgiveness that needs to happen.
Yes.
There's something that needs to be said. And it's not always a day one thing that we get to talk about. Like this could
Oh,
be 4 or 6 visits in when someone finally says, I have no feeling in my breast, or I hate the look of my body. I'm ashamed about my body. And so, yeah,
mm.
we get into some lovely but heavy conversations.
Heavy. They're very heavy, and I do
Mhm.
kind of have to mentally prepare myself for those days. My husband has heard this many times, but I told him like I just need to sit in the car for like 40 minutes.
Yep.
So, and I
Sit
literally
time.
sit
We
there.
call it sit time.
Yeah, you need to sit because you're just like reflecting on the day. Usually we're really good about like Epsom salt baths at home.
Mhm.
So that's like our way of cleansing. You can go down any rabbit hole you like to find a way that you heal better as a practitioner too.
Mhm.
I think that's kind of like the missing link. I feel like no one ever talks about, hey, what about the doctor? Is the doctor okay?
Yeah.
Uh, so that's why I always tell people when I feel that I'm not or not providing the best possible care for my patient, I pull
Mhm.
back from practice. I do.
Yep.
I'll be like, I need a day. I need a day.
Something's up. I can't get to this depth.
Right.
Yeah. Yeah. When I have a superficial day, which we can't always save lives every day, we're
No,
not going to do
exactly.
it.
Mhm.
But when I know I have a couple strings of superficial days where I have nothing else to give, or I do see the body presents me with some story or something it
Yeah.
wants me to ask about and I omit it,
Mhm.
that's when I know it's time to take a break
It's time.
to reboot. Yeah.
Absolutely. Absolutely. I think that's kind of a lost topic in even all the schools of chiropractic. No
Mhm.
one talks about how to make sure you're okay
Well, it's
as a
business management, right? You just have to
It's
keep
it's
working
yeah, it's
to make
management,
money.
absolutely. So I always tell people just as good as you are with your patient,
Mhm.
you gotta take care of yourself too, because if
Right.
you're not present for that patient, you're doing them a disservice already.
Absolutely.
So, and that's like a hard conversation to have with yourself, but those are
Mhm.
very important because they'll keep you going and they'll keep burnout at bay.
Yeah. And there's, depending on like what philosophy people's has been
Mhm.
exposed to this, in this chapter, I introduced this as like how I break people in to the
Yes.
layers of the depth of us.
Mhm.
I can't just say like, oh, go take an Epsom salt bath. Like they don't understand why that helps
Right.
or what needs to be cleansed. So I go back cellular. Like I start
Yeah,
cellular with people. You have
okay.
to. Like I found all this stuff because I had that not cynical mindset, but I was like, I'm not just going to take somebody's word that my hands are affecting some non-first, something I can't see in the body. Like I needed to have
Right.
a personal experience. And then I kind of had to find the science a little bit. So I'm going to just like gently introduce a couple of those layers and then we'll dissect them. No
Perfect.
pun intended. We'll dissect them a little bit, but even just down to that cellular aspect. So it's really easy to introduce like trauma, emotions, memories when people talk about scars, but there are so many collections of tissue in our body that are not considered a scar or have not been intervened, but it's still stagnant. It's still, the inhibition is there, or your brain has lost a connection with it. So
Right.
those are when I'm talking to people like, hey, like maybe your nervous system is being blocked via a joint issue, a faulty movement. So those are like what we would consider, which is so powerful, but that's that superficial kind of stuff.
Right. It's superficial.
Yeah. And that fixes and helps so many people. I never want to like sound like we're like, dissing that, but I will speak for both of us here. I think we tend to attract people who have either been in that realm and need more.
Yeah, of course.
So I find that people find us who are needing more and are going to get right to this stuff quicker. So, stuff we're taught in school, I really start with like the idea of chemical pain.
Yeah,
just
absolutely.
like explaining the idea of like, hey, there's this like mechanical issues that can go wrong in your body. And then there's like these, systemic things and things going on in your blood, which I know you do a lot of, blood work and things like that in your practice.
Sure.
That's not necessarily like a strong niche of mine. I stay more in like the rehab yoga mindset.
But it's like, if I have to, I will refer out to someone that I truly trust in that,
right.
And then we'll go from there.
Right. I love having a naturopath or a functional medicine practitioner on my card and like, oh, here, I love this guy. Please go see this guy so we can work in conjunction. I can get you structurally set up, but if chemically, hormones, sleep cycle, everything's so thrown off with your blood sugar levels, your cells are inflamed to a point that there is no balance right now. So let's get you in a chemical balance. So you're physically, we can combine those two. People tend to get that. They're like, yeah, that makes sense. I understand like that medical system. Then as they get to know me a little bit more, then I start talking about, which maybe people would call like psychosomatic pain. This idea that a pain can exist in your body, but it does not have a tangible like cellular source. It's kind of more of a mental and emotional trigger.
Right.
I think the word psychosomatic is like very not popular, but people can like jive. Yeah, people can jive with that concept. And now it's not really described in school though, because there's no application. I don't think it's taught because it doesn't teach you how to fix or how to address that issue. What would you say?
I think it's talked about, but very, like I said, superficially, unfortunately. I think it's hard because everybody's so different. So it's hard to put a title to something.
Right.
So, which is okay. But in a way, you want to be able to classify all these types of pain because it'll just help you in the room. Yeah. Or in your sessions, whatever it may be.
Yeah. And for me, classification is, like I said, just like to really explain people. Like I want them to have this like bar of knowledge that is beyond like, why can doctors only have the information? Like, the benefit of our society these days with such amazing access to information is like the bar is raised so high. So I want them to know that, hey, there's this word that people are going to talk about, psychosomatic. And while yes, you may think that that's something you're dealing with, let's reel it in, let's pull it in. Let me show you some examples of how we can quickly talk you through like a guided meditation, a visual meditation. And we can change your pain immediately, or we can change a strength immediately. I think people are still keeping it in like a diagnosis classification, not applicable, let's work on it today, talk me through it kind of conversation.
Right. I would agree with that too. And here's I actually have a funny story, and I kind of laugh at it, but it was really like eye-opening for the psychosomatic world. Right. I remember I was working in a PT clinic. I was just a rehab tech. I wasn't doing anything. And the person I was working with was ultrasounding someone's heel, and the patient's like, oh my God, it feels so good. But I realized the machine wasn't even plugged in.
Oh my gosh.
And I'm like, wait a minute, is it top-down pain? Yep. That's what I kind of thought. And that's the first thing I went, and God forbid if I said that like to the person, because they would have been in a lot of trouble. But I just kept my mouth shut, and I'm like, you know what? I have to research this more because I was like, if that made that person feel good, was it just like the touch or the idea that you're like, oh, bringing attention to the site of pain, or just, catering to the site of pain. Right. So when that happened, I was like, that's it. There's more out there.
Something's going on. Something's happening.
Questions. Yeah.
I like that you said top-down pain. That's a great way to put it. And when you get into like the realm of, I know you have some visceral training in your practice, just in your, not practice, but personal practice too. Your personal healing. Yeah. So viscera meaning like the lining of organs and things like that, and their attachment to muscles and pockets of pressure throughout your entire architecture. And so like if, for example, when we're doing soft tissue work, we're not just like rubbing the surface. Of course, we know where the muscles are, but I think a heightened practitioner understands how the pressure can change when we're working. We can shift pressure in different areas of your body. That's why I may have you like pay attention, breathe into I always used to hate in yoga, they'd be like, breathe into your left calf. And you're like, what does that mean? There's no lungs there. It's just this idea of attention, intention. And then as we're working on soft tissue, we are disturbing cells that may have been there from a very young age, where you developed, your body develops cellularly the structure of its sockets when you were playing sports or movements. So now as an adult, even years later, I ask you to raise your arm overhead. It doesn't necessarily have to hurt or have been an accident, but right. I can tell that you developed during a certain sport. So we're going to talk about what was going on in your life around that time, because I believe it comes to the surface when we pick it up.
Absolutely.
Talk to me a little bit about we already talked about how viscera, usually there's like scar tissue, there's intervention there, but what are some things you're looking for? How do you explain, hey, I'm working with your organs right now? How do you explain that to people?
Okay, so I always talk to people about, remember I was saying, this is your home. Mm-hmm. So whenever you are working on someone in there, I'm like, do you mind? Like, we always make sure there's permission, because if I go right in, oh my gosh, it's like people like shy away. Yeah.
They laugh. They're like, oh, it's so ticklish.
Right. Well, here's the thing. When they're ticklish too, that means that I know they're tight. They're protecting something. Mm-hmm. So I'll make sure I warm up the tissue. I'm like, guys, let's work this a little bit. Like, I mean, I noticed you're real stuck in the diaphragm or your pelvic floor. I mean, I can't get into the depths of the pelvic floor, but at least it can touch around the surface, or at least give you an idea of maybe that's what you need.
Send them home, send them to a pelvic floor PT.
Yes, that's exactly right. So what I'll do is I'll work it, and I'll see if I can get them to breathe a little bit better. See if they can get that nice 360 brace, or just be aware of it. And they're like, oh, I really need to work on that. And usually that wakes them up a bit. But then as I keep going, I'll get a little deeper and deeper, and I'll tell them, like, I'm going to put some pressure on here. Let me know what you feel. And then they're like, I feel gurgles. I'm like, perfect. Let's keep getting the gurgles. I'll notice people will release. I one time had a lady, her rib cage went like that. And I'm like, holy cow, how was it painful? She's like, no, I can breathe.
Yeah. Like it was like, rigid. It was being narrowed.
Yeah. Oh yeah. So I think people are more open to it because they know it helps so much. I've had it also where people go home and maybe they are like worn out, cried, slept, and then they wake up the next morning. They're like, I think I'm a new person.
Yeah. I actually slept. I actually turned off. Yeah.
So what I found is I feel like it's a great way to work the vagus nerve from the other end. It's just a way to kind of get that rest and digest kind of state, give you that breath of life, just till you can be you throughout the day. I love that. That's my favorite thing. I think the vagus nerve is completely like out there, but I love it because it's so foundational.
It is that bridge between both systems, the heightened system, the relaxed system. Yeah.
Right. So I feel like that was a great way to incorporate that. And I noticed yogis love it. They like, oh, this is bringing awareness to. I noticed a lot of teenagers love it because they may be fighting with, unfortunately, a disorder of eating of some sort. Or just anxiety in general.
Right.
I've also noticed young men really struggle there. I didn't realize like how much shame they put in their gut.
Yeah.
So, which is really sad, but I had a really good conversation with I want to say an acupuncturist, and he said like men hold their emotions in their gut.
Interesting.
And women hold it in their chest. And I was like, that's so cool.
I can see that. Yeah, I can definitely
totally think about it. Like women, well, what you said about plastic surgery too, maybe there's some shame there, right. Or maybe they're just so tense and they're guarding their heart or whatever it may be. But I noticed young boys, if they're anxious or tired or just crabby because things aren't going their way or something, they get stomach aches, or they don't eat, or they binge. So it's like this
cycle. Yeah, absolutely.
Yep. Absolutely. And I think that's so cool. I mean, it's amazing to see, and maybe there's no black and white answer. but the
Right.
best about it is in the gray. So it'll shift with that patient.
I know. I mean, we could talk about this all day. It's like there's, now years of these like eye-opening, like mind-blowing experiences, which
Mhm.
is really kind of what encouraged me to want to like sit down and write this book, was just because I felt like I was answering a lot of these, what I
Yeah.
thought were just, you know, understood knowledge or basic knowledge. And people had no idea that me poking around in their stomach, which may be tender, which may push around gas, which may show them like, see, that's my chronic UTI area. They didn't
Yeah.
understand that in 30 minutes, it can be gone, or like we can dissipate it and teach you practices to do at home. So it was those messages that really inspired this chapter of like, how do I verbalize
Yeah.
the concept of like an internal brain?
Yeah.
How can I use that to, one, validate why people do love organized practices like yoga and stretching, Pilates, anything really. But then how can I use that to almost introduce like then the next layer of, okay, we're past that organs, pockets, pressure, nerves, hormones. Like now we're talking about your mind's influence
Mhm.
on your health, on your symptoms. And so that's where I go into now, like my deepest layer of what I describe as like metaphysical, like above the physical
Sure.
type of pain. And it's not to diminish anybody's experiences or the harshness that they've been through the medical system. I never want to say, oh, see, it's in your head, get over it. Like,
Yeah. Yeah. No, 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 no.
right, right. Which is, I think a lot of people hear when they're going to a doctor who calls their issue psychosomatic pain. Like, it's just like, get over it kind of thing, or see a therapist.
I feel like they put a good word and made it bad because now it's superficial.
Yeah.
And what they should say is like, okay, you're like an ogre. You have to peel away the onion kind of thing. You have layers.
Right.
Um, but when you say, I always tell, that's actually what I tell my patients. I'm like, think about it.
We're going to
We
peel
have,
the layers off of you.
yeah,
Yes.
we're peeling at the onion right now. And eventually, and I even tell people like, I will tell you if the pain moves, something's going on and it's a bigger picture.
Mhm.
Because if you just have it and it's pinpointed to one spot, that's a different story. But
Right.
when we start working you and now you're traveling to different areas, like now you're telling me a story
Mhm.
and I need to pay attention. That's my job. You
Yeah.
come present and you're ready to work and heal and do whatever you got to do at home. But
Mhm.
let me do this and we'll get you there.
Yeah.
But we'll do it together.
Together. Absolutely.
And
Similarly to like layers, like in your onion reference, I like to describe like, the rings of a tree. Like if,
yes,
unfortunately you ever see like a tree cut down and you would, look into, I know, so if you ever look at the, like the rings that grow out on each other, on the surface, that tree may have looked really healthy, but you can actually, like, when you see the section of it, you can see the years of health within that tree. Like maybe there's a
yes.
ring of nutrient loss, there's a ring of infection, there's a ring of dehydration. We have that. Of course, we're always making new cells, and your body is amazing at getting rid of, not healthy cells. But just because I'm out here on the surface, like working on you, the top layer, getting into those deeper layers shows us the true level of cellular health, emotional health at that year of your life.
Absolutely.
Things like acupuncture and the needles are just an amazing way to dive into some of those deeper layers. I believe they're portals. But things like deep breath, deep pressure, certain positions, that idea of like the metaphysical pain is probably, I think, kind of what I'm becoming known for in our area and things like that with patient care. But it's like we don't have access to treating people if we just use that as like, oh, I work on blah 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 mentality, pain mentality.
Right.
People need to know and trust like our validity of our profession. I'm a chiropractor first and foremost. I always use the opportunity to say, hey, we're not doing chiropractic anymore. I want you to know the difference when we're working on this. And I mean, it overflows probably so effortlessly with you, but I think for like new patients, I really try to help differentiate that.
Absolutely. And like that's the thing, you're gonna know how to read your patient when how they converse with you and all that fun stuff too. But I, when I was looking through your book, Marina, I love it because I feel like you organize curiosity. That's what you
Okay.
did. That's like my take on it, which is great because the minute a doctor isn't curious, I think that they're like checked out. They're checked out. And when you work on a patient, you should never be checked out. If it is, maybe they're not communicating with you, or like there's maybe something going on, maybe the vibe is off or whatever it may be. Because I'll tell you what, I've had patients that I know I'll talk to them, but I can't talk to them. Like there's no words. Like
It doesn't
so
have meaning.
frazzled.
Yeah. It doesn't have that depth.
Yeah.
Yeah.
Right. But that's the person I have to step out of the room, take a deep breath, and then come back to it.
Mm-hmm.
When that happens, it's just like, okay, let's calm down. Let's, I get it. You're frazzled because you've been dealing with injury for so long,
Yeah.
but I have to almost change their mindset to it, or
Mm-hmm.
their intention, or whatever it may be. And I even tell them, like, just because in the past, you can't change the past. I
Yeah.
said that, no biggie, but we can change how you feel about the past.
Mm-hmm.
So if we can change that, that's half the battle.
Right.
Maybe I may need a counselor to help me
Mm-hmm.
with that. And I'm cool with saying that, like, hey, I know someone, I actually have a really close patient that I love referring to because she does that. And so she helps my job.
Good.
So
Yeah.
we work together. And I even say, could we, like, are you okay if we have open communication between the patient and the doctor? And they're like, usually everyone is, yes, we'll do it. So it's a team. It
Yeah.
really does take a village.
Oh, absolutely. And I think we have a little bit of just an interesting take on that as female providers, because there is this just, you can't describe it, kind of sensation that people feel nurtured, or, you know, they also feel that balance of like, while yes, we're like nurturing women, approachable women, like we have fiery women. So like there is this also, yeah, I'm talking to you. There is this like, I can be nurturing and I want to bring this out of you, but I'm strong enough to hold this space and like lock down the fort so you can really feel and witness 100% like what you need to.
Yes.
I really like that, the idea about the curiosity thing. Thank you for saying that.
No, seriously, you organize curiosity. And that's what I thought was like the beauty of it. And I feel like every doctor should do that.
Yeah.
Like they have to. Like you'd be like, oh, that's a good topic. Like no one should be like, that's stupid. No, never say that. That's mean. You should say, yes, I'm gonna look into that further. And my patients know, I'll be like, I've never heard that, but I'm gonna check it out.
Yeah. I mean, we just witnessed so much like things that we don't have whys for, we don't have answers for. And as a clinician, we like protocols and we like procedures. So I really just started documenting patterns. And this is that final depth of what I want to talk about in this chapter is really like the crazy stuff, what I call metaphoric pain.
Yes.
So something that you believe so truthfully in your mind that your body now becomes that story. So some examples that I use in the book are like, you know, someone comes in and now I just know to ask when I see, and they have this like singular spot in the middle of their rib cage in their back. Of course, I'm looking at the manual stuff. Of course, I'm helping them, but I'm at some point today, I'm going to get into the conversation of stress, and I'm going to ask if they have an experience recently or since this pain has started with betrayal.
Yeah.
Because this is a metaphoric site of feeling stabbed in the back. And the human language is like endless metaphors, and we all in different regions and different dialects have, you know, different patterns that we hold on to more in these dialects, or in these metaphors. But I've just seen so much of them and I have been able to quickly influence them that I felt comfortable like writing them in this book. And I'm like, these patterns within our brain, or these unexpressed emotional communication patterns, come out in our body if we don't believe that they're there, and they just kind of linger. Would you say like some of you said the constant, like the shame that you have in men and things like that? Not that you're looking for metaphors, but are there any other type of like patterns that kind of you see and you know you're going to talk about something different today than what they thought they were coming in for?
Yes. I think of one patient specifically, and I remember her coming in and I was like, she feels nothing, like nothing. I was like, how do you feel nothing? Like she literally was not aware of anything in her body. And that kind of scared me.
Yeah.
Because that means that woman has been putting up walls for days.
Yeah.
So
just tapped out, just like
she wasn't even like, I asked her, like, do you feel like your feet when you touch the ground or put your feet in sand? She's like, she gave me like a and I got to the point where I'm like, all right, talk to me about your life. How stressed out are you? And she's like, I am so stressed, I don't even know what I'm doing. Like,
numb.
She's numb. She was completely numb. That scared me.
Yeah.
That is the one time I was actually like, oh my gosh, what do I do with you? Like I was kind of stumped, but I'm like, you know what, let's just come in what you came in for. But she came in for a calf thing, and that's fine. But the fact that she was not aware of anywhere else in her body, that scared me a lot. but I kind of chased her pain a little bit, but then she started to open up as we got the touch going on, and she understood like, oh, okay, she's trying to work me through so that I can perform on whatever I'm doing.
Yeah.
And eventually, like she said, the stress is so much that she's very scared with, so unfortunately, with all the COVID stuff going on as well,
Mhm.
she said that she felt like she was always on edge. And I think that was her body just being burnt out.
Right.
Um,
Almost
so
overstimulated to the point where it just had to
right.
wipe
And
us
that
out.
scares me. And that scares me because we are sensory beings.
Mhm.
So the minute you don't feel anything or like noise or anything doesn't affect you, I feel like
Right.
you're just slam the human experience down into the dirt.
Yeah. Well, and two, for you and just anybody who gets into this depth of like touching people and interacting with people, I think half of our gifts come from just like empathizing and not just like I hear them and I sympathizing and empathizing are different things.
Yeah.
Empathizing is like I want to almost visualize myself in that position, in that pain, so
Right.
I know how I would need to heal and how we can move forward together. So for you to like meet somebody and has no sensation and it's just not even there and present, like I think like the mirror neurons in our body are like afraid to be in that realm.
Yeah.
So definitely, like you said, recognizing when it's time to take care of yourself when
Yeah.
you're afraid of that experience and just melting her slowly together.
Melting her slow, literally melting her slow. I was like, you're like a candle. We're trying to get it to burn a little bit. But I think once she started getting like the realization that it's about everything, the way you feel, the way you think, the way you see the world. And I think she did come, I want to say she did really well. Like I remember to this day like how tight she was. And I was like,
Mhm.
you're a shell. Like you're just a shell, you're a turtle. And when she came around, I was like, look at this. And it never really came back, the pain, which was kind of
Right,
cool. I don't tell people I took her pain away because I didn't.
right.
I think it was more just her perception of everything. And
Yeah,
she got the help what she needed and she kept going on and doing what she loved. So I think that was really it.
that's
Um,
beautiful. Would you say like you're using your presence, your personality? Like, how are you helping just, in that relatability? Is that how you're helping people kind of rewrite these experiences and perceptions?
I always try to bring people like a little bit of light to it. Even like every advantage has a disadvantage and vice versa.
Mhm.
So I always tell people, how can we make that a positive thing?
Mhm.
Whether it be a breakup, I'm like, well, at least the breakup is over, but why is it good that it happened? Like, how
Mhm.
do you feel? How is it liberating you? Or
Yeah.
what can you do to make yourself a better person? So I almost try to steer them into the positive, but I let them grieve too. So I have to find where they're at and meet them
Mhm.
where they want to be eventually, but it may not be now. It may be like a week,
Yeah, it's a
2 months,
skill
a
set
year,
to
5
recognize
years.
the time frame on, all right, you need processing time. Next time
Right.
I see you, it is just nitty-gritty muscle work. Like we are
Yeah,
not going to be saving lives talking about your deep emotions. Every time you're in here, life has to happen for a lot
like
of these things.
absolutely.
Um, and with some of those other like metaphoric type issues, a lot of time it's not my place to, even when
It's
now that I recognize them, I have to be very careful with very personal areas. Like when I was working in Oklahoma in the Bible Belt, we see so much overlay of belief and, feminine health and conflict with belief and religion there, that, I muscle test almost every part of the body with people to see where their strength. And I had so many women with just absolutely chronic weakness in their inner thigh, muscles,
yeah. Oh yeah.
pelvic floor issues, prolapse, and there always is going to be a conversation of, how can we address gently those
Right.
really hard concepts? Because I don't want to just say, oh, this is not the job of a chiropractor, I need to send you out. Because if they have built this rapport with me, they finally have opened up to this level, I'm not going to ever nip that in the bud and say, not
Right.
my job, I can't talk
No,
about
no, I won't
this.
do that. I'll be like, I could only go so far, but
Mhm.
just know that this would be a better suit. Like, let's try it, if
Yeah.
anything. But I'll also say, let's try this too with it. Like, whether it be yoga or deep breathing, whatever it may
Mhm.
be. I'm like, wherever you want the person to just meet you in the middle a little bit.
Yeah.
Um, but it's like, I always tell people, you ever play Mario Kart?
Oh yeah.
I'm a little star where your car goes a little forward. So that's where I want to shoot you forward. I don't want to shoot you backward. It could happen,
Right.
but it will try to shoot you forward,
Yeah.
which is kind of fun. So, and they get that because like they know I'm like just using things in their day to day that could be a
Mhm.
positive or whatever it may be. But it's just like I said, changing the meaning of what happened or the intention.
Mhm.
sometimes I need it too. My husband knows, like, I need sometimes to get like just snapped out of my like funk, and he knows how to do it. So I'm like, yes. So that's why our relationship works as a business partner and a marriage, because you kind of need someone to be there for you, or be your like, just wake you up a little bit.
Absolutely.
And I feel like everybody needs that person in their life. Everybody.
I hope I hope people can just get the sense of like, one, how much we care about this type of work. Not just because we like applying it to other people and we like, you know, being successful in that realm, but because we have utilized it in our own lives, on our own bodies and our injuries. You know, we are the representation of our belief in this medicine. So I think that's really where it comes from.
Yes. And I think, and you can't fake passion. You really can't. No. So I think people know when you're full of it, and when you're like, this is their jam. So and I always tell people, I'm like, listen to your gut. Like, if you go to an appointment, you should have some little bit of hope, at least excitement, or just some optimism. And that's the best part, when you have that. And if you don't, like, you know what, find someone that works for you. It's cool. In the beginning, I used to take it personally. Now I'm like, whatever, you know what, maybe I wasn't the doctor for you, or maybe I need to learn a little bit, but it's okay. That's okay. So I've come a long way. So, and I think every doctor has probably come that way, or at least I hope they have.
I hope they do too. I mean, even that you can get to a point to work in conjunction with other chiropractors. I know I want to give people that, like, where they're so loyal to their doctor, that I want to be like, hey, that's great that you went and saw this person. I know that when you're in this door, there's a reason that you and I need to be together today. That does not need to be every time.
Nope. And that's cool. Like, I think that's cool. And I really feel everybody will find their way. Just don't take yourself out of the game, though. That's that's the scary patient too, is when the patient comes in and they took themselves out of the game already. And I'm like, oh, we're going to get there. Like, have some hope, have something to give you a little bit of an excitement, or whatever it may be. But
as soon as it gets quiet in my session, which is not often because I'm so good at talking, but when it does get quiet, I always ask everybody, I'm like, hey, what do you got looking forward to? You know, what's next? What's coming up? What are you looking forward to? That's the imprint that we're trying to help people leave with, for sure.
We kind of laugh, but at our office, we have a little inside joke. We like to have chocolate ready, or dark chocolate ready for everybody. And we're like, everybody leaves on a good note because they have some chocolate.
Some dark chocolate.
Some dark chocolate. It's just kind of our thing. And one day, I remember yesterday, someone's like, where's the chocolate? I'm like, oh my goodness, I'm sorry. So,
especially this time of year, Valentine's Day is coming up. You gotta have that candy ready.
Well, I always tell people, I'm like, you gotta enjoy it. Like, obviously don't eat candy all day long, but you gotta enjoy it. So it's pretty nice to like see that. And I'm like, you guys are so funny. Like, just the silliest thing, but I mean, like, I get it. We're exhausted. We went through a lot of tissue and a lot of even emotion with I don't know. I can't section emotion with tissue. Like, I can't. They're together for me.
They are together. Yeah,
they are. And I always see these people as, like, I don't want to say my friends, but kind of like there's a friendship and there's a trust, and we're working hard, and they have to get credit too. And I think they really do. Patients really need to give themselves some grace too.
Yeah.
They deserve it. And that's just the thing. Give yourself some grace.
I must just thank them at the end of every appointment. I'm just like, hey, I really appreciate you trusting me with conversation. I know it's not easy, but you know, I'm right there with you. And half the time I'm like giving them advice, and I'm like fixing things in my own life. We are definitely coherent.
We're together. We're
definitely, yes, putting ourselves in the same boat. And I think that's why we live and lead healthy lives alongside of them. So
heck, I couldn't be a rack 'em and crack 'em doctor. I would be so bored.
I would be.
I feel like all my strength would be useless.
We get to nerd out like this kind of stuff all day, every day.
That's true. It's true. I'm like, man, I told my husband the other day, I'm like, this was a long day, but it was good. It was good. So, for sure.
Well, I'm like now reinvigorated in my career, my passion. I'm excited to like treat my afternoon patients. They're in for it tonight now. I feel like after this conversation.
And that's the thing. I wish more colleagues like reached out to one another to boost them, because you can have a kick-ass discussion about how to help yourself, help other people, and then you can't. I'll be honest with you. I hate having these conversations at night because I'll stay up all night.
Yeah. It just like gets the gears going. Yeah.
Yeah. Or if I read a book and I'm like, yes, that's what I needed. So like that's the worst because I try to read at night sometimes and I'm like, nah, I can't do it anymore because I'll be like sitting there. I'm like, okay, what do I got to do the next day? So I'm like, all right, I got to give myself some time.
That's writing for me is like, I need to organize this in my mind. I need to put it on paper and I need to get it out there. So I don't have to like keep like struggling with this. There.
You did a good job. Like I said, I love this book because it is organized curiosity. I think everybody should read it because, well, you can't not take care of yourself. You have to. I do have a list of books though. I was like ready.
Please, yeah, hit us with some other recommendations and things like that.
Okay. So I like to go from nerdy to informal. That's just the way I do it. Okay, so nerdy, obviously Anatomy Trains. This was like my first thing in college that got me going. It is something that is whole body and you shouldn't ignore it because it's not talked about, but the research is pretty darn fabulous. It still needs to be researched, but I just love dissection. So this is just a way to bring everything.
Teaches you how crazy foreign parts of the body are connected and moving together.
Yes. And I think that's a great place for people to start and look at. But if you want like a little bit of a lesser heavy text, I love the fascia release.
Okay.
Balance. This is a good one. I like this one. I read this one on vacation a lot. Just because it's my foundation. I know I shouldn't say that. I read that next to the beach. My husband's like, why did you do it? I'm like, listen, I gotta read this. Okay. But I really love this book, Spark in the Machine. I feel like this guy did a great way of fusing Western and Eastern and just keeping you open. It's just being open. And then this is my funny book. This little art of not giving it. Yeah. This is a great book. I think a lot of people need to read it just for laughs and giggles. Just because, well, you know what? You know how you stimulate your vagus nerve? You laugh. You deep belly laugh. Those are the best kind of treatments right there.
Take yourself a little less seriously.
Take yourselves less seriously because honestly, I feel like whenever yes, I get it. Like, you know, I've been in the cancer treatment centers and I was the youngest one there. And I remember like being like, Mom, I feel like I'm dying. She's like, no, we're going to watch like comedy or read something funny. Like she kept me upbeat. And I really think that that's a mental thing. I think I bounced back so quickly from it because I was so positive and my mom made me go back to school. She's like, you're going, you're not staying home. You're going because you need to do this. And I love her for that to this day. And, you know, and it's just exercise. Like my brother would go on bike rides with me and it's just something that you can do to get out of the house and just see and just indulge in nature and heal yourself.
Movement is medicine.
Movement is medicine. It is. And it's so I think now actually it's becoming more of a thing. So, or not more of a thing, but it's more mainstream and that's awesome.
Recognized, understood. Yes.
Yeah. But never, ever should you ever take emotion out of any of this. No. That's the beauty of it. It's a chaotic world.
Well, thank you for being part of that movement. And, you know, it's amazing to think of how many people, do you say you have another one?
No.
Oh, I was gonna say, it's amazing to think how many people like individually you've worked on. And it's hard sometimes that we don't see that ripple effect, but we don't know the change that's made and then how they have gone out and shared that message, shared that new personality. So your influence has definitely even reached me where I'm at in New Jersey. And so I hope to send it back a little bit too. This is such a great conversation. Thank you so much.
Oh no, I appreciate it. It's so much fun. Always great to see.
Oh my gosh. Yeah. And thank you for those recommendations. I'll type those up in the comments and the bio of the video that we're going to share so people can reference that.
Oh, for sure. And like, that's the thing, finding a book even along any topic is pretty cool because it just gives you an opinion or just some insight that you're like, oh, I never thought that way. That's pretty cool.
Yeah. What's that line? It's like, if you only read the same books everybody is reading, you can only think the same way everybody's thinking.
That could happen. Or unless you convince people like the opposite.
Other way.
It's a pendulum. It goes one way, it can go the other way. So we could you never know. So it's cool. I think that's the best part about being human is you can think for yourself and do your thing. Do your thing.
That's really popular right now. Conversation. That's a different conversation for a different day. Oh my goodness. Well, it was so great to see you. Thank you so much for being here and chatting with me. And we're definitely going to do this again. We're going to have to.
Awesome.
All right, Melissa. Have a great rest of your day.
Have a great Monday.
Bye now.
Bye.